Do you frequently feel like your heart hurts sometimes? Or do people say your child is overly friendly, even to strangers? Have you noticed unusual facial features or delays in learning? These could be clues to something rare called Williams-Beuren syndrome. Imagine a puzzle where one tiny missing piece changes how everything fits. That's a bit like this condition. It's not common, but it affects how a person grows, learns, and even how their heart works. Let's explore this together, not just as facts, but like we're talking to a friend who wants to understand. What causes Williams-Beuren syndrome? Think of your body like a big instruction manual made of DNA. Now imagine if one page, actually about 25 to 28 tiny instructions, went missing by accident when the manual was being copied. That's exactly what happens here. A small piece of chromosome 7, which carries important genes, is deleted when the baby is forming in the mother's womb. One key missing gene is called ELN, which helps build elastic in blood vessels and skin. No one does this on purpose. It's a random mistake, like a typo in a recipe. It usually isn't passed from parent to child, but sometimes it can be. So if one child has it, parents often worry, could the next child have it too? Usually the chance is low, less than 1%, unless a parent unknowingly carries the same deletion. What signs might tell you something is different? Let's picture a child named Mia. She's super cheerful, loves to talk to everyone, even the mail carrier, and has a wide smile people often notice. But behind that sweet face, she struggles to tie her shoes or understand simple math. She may have elf-like features, a small upturned nose, full lips, and a wide mouth. Her heart, it might skip a beat, not emotionally, but physically due to tightened blood vessels, especially near the heart. That can cause chest pain or tiring easily during play. She might be scared of loud sounds, like a balloon popping or love music deeply. Some kids with this syndrome are super social, but find hugs too strong, like their senses are turned up too high. So while Mia is full of joy, she also faces daily hurdles in learning, hearing, and body strength. How do doctors find out if someone has this syndrome? Let's say Mia's pediatrician notices her heart murmur and learning delays. They might ask, could this be more than just shyness or slow learning? The next step, a special blood test called FISH, or genetic microarray. It's like using a magnifying glass to check if that chunk of chromosome 7 is missing. Once confirmed, a team steps in, heart doctors, speech therapists, and teachers to help. There's no cure, but treatment helps each issue. For heart problems, medicine or surgery can open narrow blood vessels. For learning, special education plans build skills step by step, like teaching reading with pictures and sounds. Physical therapy helps with weak muscles. Regular checkups keep an eye on calcium levels, which can be too high in babies, and blood pressure. It's not about fixing everything at once, but supporting the person for a happy, full life. Can we prevent Williams-Beuren syndrome? Right now, we can't stop the genetic deletion from happening. It's like trying to prevent a random lightning strike. But families can get help before having children. If one child has it, parents can see a genetic counselor, like a guide who explains the odds. They can test during pregnancy using amniocentesis or CVS to see if the baby has the deletion. But here's the real value. Prevention isn't just about stopping it, it's about preparing. Knowing early means helping the child from day one. And raising awareness, that's prevention too. When teachers and doctors recognize the signs, kids get help faster. So while we can't stop the missing genes, we can stop the delays in care. Scientists are like detectives, always hunting clues. Right now, they're testing drugs that could improve learning and thinking in people with this syndrome. One study gave a medicine to mice with the same gene deletion, and they got better at maze tests. Human trials are happening too. Another exciting idea, using music therapy not just for joy, but to boost memory and speech. Brain scans show that people with Williams-Beuren use different parts of their brain when socializing. super connected in emotional zones. Researchers want to use that strength to help with weaker areas, like numbers or focus. Even gene editing tools like CRISPR are being studied, not to fix people, but to understand how to support them better in the future. So hope is growing, not for a normal, but for a world where every person with every genetic difference can shine.